Good afternoon. I want to thank Commissioner Riley and Secretary Pizer for joining with us today. We're going to talk a little bit about getting kids back to school for in-person learning, but I do want to give a quick update on some COVID-19 data. The hospital census is currently 888 COVID-positive patients in the hospital, 229 are in the ICU. It's about a 65% drop in daily hospital census for COVID patients since the peak in early January. There are 1,150 new COVID cases, which brings the total number of COVID cases in Massachusetts to about 541,000 confirmed cases, and that's on a testing base of about 15,600,000 tests. 7-day positive test average is, for the first time since about October, below 2%. It's down to about 1.9%. On the other side of the coin, we continue to be the number one state in the country among our peer states, the 24 states that have more than 5 million people, for first doses per capita, and we've been in the top 10 nationally now for the past 2 weeks. We also have, according to Bloomberg's data, which is off the CDC, the second best vaccination rate in the country for black residents. And as of yesterday, over 30,000 new doses of vaccine were administered here in Massachusetts to our residents, and currently about 85.4% of the total doses that have been shipped to Massachusetts, which is over 1.7 million doses that have been shipped. About 104 million of those have been administered. 107 million. So 1.7 million have been administered and 1.4 million people have received their first dose. We're clearly making significant progress statewide as we continue to vaccinate eligible priority groups in phases 1 and 2, and we also continue to stand up more mass vaccination sites across the Commonwealth. Yesterday, the site at the Natick Mall opened its doors, and tomorrow, another site will open in Dartmouth. We continue to build upon and improve upon our vaccine distribution program and encourage everyone to continue visiting mass.gov/COVID vaccine to learn more. I think we all know that when COVID hit last year, just about this time, teachers, staff, and students experienced an incredible disruption to their daily routines in school, and ever since have been adapting and adjusting to the challenges that came with the pandemic. Many districts have worked hard to create strong learning experiences for their students, but I think we all agree there's no substitute for in-person learning, especially for kids in elementary school. Our administration's been clear for months that the best place for kids is in the classroom. And today, Commissioner Riley started a process working with the Board of Elementary and Secondary Education to get more kids back into the classroom full-time by phasing out remote-only learning in April. Commissioner discussed the process, which will start with elementary school students, with the board this morning, and we hope to be moving ahead soon. We know the pandemic's been difficult on everyone, but it's been really tough on kids and their parents as they struggle to be out of the classroom and detached from their teachers and their peers. Many districts have been increasing classroom time. Currently, about 80% of districts have in-person learning, whether hybrid or fully in-person. Districts with in-person learning, regardless of how high COVID transmission is in their community, have seen few, if any, examples of in-school transmission. With the proper mitigation strategies in place, developed by our administration with leading medical professionals, schools across the Commonwealth have been able to safely welcome kids back to the classroom for many months now. There are still approximately 20% of districts that are still learning fully remote. This affects roughly 400,000 kids, most of whom haven't been in a classroom since last March. With COVID cases and hospitalizations continuing to decline and vaccines well underway, it's time to set our sights on eliminating remote learning by April and starting with elementary schools. And the districts need clear direction about what will count as acceptable learning time as the Commonwealth moves forward. We've seen the repercussions of prolonged remote learning for our kids. Their social, mental, and emotional well-being has been significantly impacted. Kids want to be in school, learning alongside their friends, their classmates, and their peers. They want to have a chance to engage their teachers in person time and time again, and especially when they have challenges associated with understanding the material. The science is pretty clear on this one. There are now dozens of reports from all over the world that it's safe to be in school, and doctors and public health experts, including Dr. Fauci, all agree that getting kids back in school needs to be a top priority. We've committed funding, resources, and supports to schools and districts to return to classrooms. And last month, we launched a first-in-the-nation weekly surveillance testing program for students, teachers, and staff that has begun rolling out statewide. Approximately 900 schools and nearly 300 students, staffs, and teachers are already participating in the program and will continue to scale up their testing capabilities over the course of the next several weeks. Superintendents and their staff in those schools have done a great job implementing this pooled testing initiative. DESE's provided hundreds of pages of extensive public health and safety guidance to guide school officials on how to safely reopen, including mitigation protocols, COVID response scenarios for schools, and transportation guidance. The guidance is extensive and was endorsed by the Massachusetts chapter of the American Academy of Pediatrics. Collectively, we've invested about $1 billion in COVID-related funding and supports for schools across the Commonwealth. We also launched a rapid testing initiative for students and staff who are asymptomatic, provided at no cost to schools, which provides accurate results within 15 minutes. And DESE's work to continuously provide schools and staff with PPE and supplies like air purifiers. Throughout the pandemic, our administrations worked diligently to build an arsenal of tools for our schools to safely teach kids in the classroom so they can get the education that they deserve. And the evidence on this one is crystal clear and has been for months. Safe to teach kids in the classroom, regardless of community transmission rates, as long as people abide by the protocols. The vaccine effort will continue to ramp up, and we're all hoping and anticipating that J&J will get approved and Pfizer and Moderna will increase their production and we'll have a lot more supply to distribute here in the Commonwealth. But we've already distributed over 1 million doses to begin with many more to come in the weeks ahead. The percent of positive COVID cases over 7 days and hospitalization rates have been falling now for almost a month. And our Commonwealth and our country are making progress in getting back to what I think of as the next normal. And it's our responsibility to ensure the kids can get back in the classroom. They deserve the highest quality education possible, and especially for the younger kids, that begins in the classroom. We look forward to working with the board and our school districts to make this happen. Now I want to turn this over to Commissioner Riley.
Good afternoon. It continues to be vital that we get as many students back in person as possible before the end of the school year. This morning, I made the board aware that I will be asking them to vote to amend student learning time regulations to give me the authority to determine when the hybrid and remote models no longer count for learning hours. If I am granted this authority, I would take a phased-in approach to returning students to the classroom, working closely with state health officials and medical experts. My focus would be on bringing back elementary students first, with the plan likely extending to middle school grades later in the school year and possibly high schools as well. Ideally, my initial goal is to bring all elementary school students back to in-person learning 5 days a week in April. Parents will still have the option for their children to learn remotely through the end of the school year if they so choose. And there will be a waiver process for districts who may need to take a more incremental approach, for example, to first move to a hybrid model if they are currently fully remote. Starting with elementary students is common sense, as there is widespread agreement in the medical community that younger students are less likely to contract the virus and to transmit it. Elementary students are also easier to cohort. And from an educational perspective, these are some of the students that are struggling the most developmentally and with remote learning. It's very hard, for example, for a first grader to learn how to read remotely. Since June, we have developed hundreds of pages of detailed health and safety guidance for school districts to help mitigate the spread of the virus in our school communities. We know that the core mitigation strategies of mask wearing, hand washing, social distancing, and grouping students into cohorts all work to reduce spread within our schools. These health protocols remain the most important strategies to keep our students and teachers safe. With our partners at DPH and HHS, we launched one of the most ambitious statewide pool testing programs in the nation. There are now hundreds of schools taking part in weekly pool testing of their students, teachers, and staff. This impacts more than 280,000 students from across the state and thousands of teachers and staff. Working with the medical community, Massachusetts schools have done an incredible job of keeping our students and staff safe during this pandemic. The superintendents and their school staff have done amazing work implementing the mitigation strategies and the pool testing, and I cannot shout them out enough. We are now asking them to go one step further to begin the process of getting more of our kids back to school this spring. I would personally like to thank all of the educators for their continued partnership and willingness to take on all the challenges we have faced this year. Thank you. It's now my honor to introduce Secretary Pizer.
Thank you, Commissioner, Governor, Lieutenant Governor, and good afternoon, everyone. Commissioner Riley's plan for regulatory revisions related to the use of alternative educational models is another important step in getting as many of our children back into their schools as soon as possible. Although, as you've heard, about 80% of our school districts in the Commonwealth are providing most of their students with in-person instruction on either a full or a part-time basis, close to 20% of our districts are operating fully remote. And many of these districts are among our state's largest. At the same time, there is an ever-growing body of evidence and firsthand experience here in Massachusetts, around the country, and around the world that schools are safe places for children and adults when standard health and safety protocols are followed. Even in communities with higher levels of COVID, there is little or no evidence of in-school transmission, with various studies indicating that infection rates among students who are in school are actually lower than among those students who are learning from home. To address the direct and indirect costs of COVID and to enable the reopening of schools, the federal government allocated almost $200 million directly to school districts last year as part of the CARES Act, and the governor earmarked another $200 million in federal aid just last summer. Another $734 million is on the way as part of the December stimulus bill, and the pending stimulus bill now before Congress promises to send hundreds of millions more in educational aid. In addition, DESE has purchased and distributed thousands of portable ventilation and air purification units. And last month, the governor introduced his House 1 budget for FY22 that fully funds the first year of the Student Opportunity Act, adding almost $250 million in state funding for our public schools. At the same time, as you've heard, the administration is rolling out the first in the nation statewide weekly testing programs for students and staff to offer even more support for in-school instruction. And the governor has prioritized individuals working in early education and K-12 schools for the vaccine in phase 2 of the distribution plan. All of this against the backdrop of declining COVID and hospitalizations. But this is not just about COVID. It's also about educational progress, mental health, social emotional development, and equity. Our children, especially those in traditionally underserved communities and other high-need students, are suffering the most, creating real learning and developmental losses and exacerbating achievement and opportunity gaps. Let me be clear. Our teachers have been working under extremely difficult circumstances, and they have demonstrated remarkable flexibility and persistence, not just on behalf of their students, but on behalf of their families as well. Nevertheless, the bottom line is our children need us to step up and give them the access to the in-person education that they deserve. The time to act is now. and I congratulate the Commissioner for starting the process of bringing students back into the classrooms, and I look forward to the Board's upcoming vote. Thank you very much.
If you guys have questions on this, I might send Commissioner Riley back up to the podium.
The Mass Teachers Union,
Yeah, why don't you talk to them?
Mass Teachers Association president called this a disaster. She said it was an attempt to deflect from the governor's failures during the vaccine rollout. Those were her words. And she asked, what is the plan to get teachers vaccinated? So I guess I would ask either one of you to respond to the first one, but also what is the plan to get teachers vaccinated?
So we know teachers have been prioritized, and I believe they're next up in line after the 65-year-olds and the people with 2 comorbidities. And so, the numbers have been going up with shots in the arms, and, obviously we want to get as many mitigation strategies as we can for our educators, whether that's mask, ventilation, whatever. We think vaccination is one important strategy, but as Dr. Fauci pointed out, I think the President pointed out, vaccinations are not required to go back to school.
Can the governor respond to?
We have a pooled testing program. We have 900 schools participating, and they represent 300,000 students, staff, and teachers. That is another issue that the CDC recommended that states and localities pursue to offer mitigation as well, on top of all the mitigation that's already been put out by the folks at DESE and worked through the American Academy of Pediatrics. This conversation is something that's been going on in Massachusetts for weeks and months. School vacation just ended. There's another school vacation at the end of April. I think from our point of view and from DESE's and from the Commissioner's point of view, this was the time to start getting kids back in class.
So do you think that this is an attempt to deflect from the rocky rollout of the vaccine?
We're number 1 in the country in first doses per capita among our peer states that have more than 5 million people. That's 24 states that are basically our size or bigger. And we've been a top 10 player for the past 2 or 3 weeks. I would hate to distract from that information because that's a really good story.
You've been pushing for so many months. You've been pushing for so many months to get kids back in school full time. Why not have teachers be part of one of the earlier phases of this vaccination so you could have to be a reality, not have to go to the regulatory reforms?
We started with, first of all, the CDC's put a lot of guidance out on how to organize and structure vaccinations. And one of the major things that they talked about, and so did our advisory group, was preservation of life. There is simply no doubt in any of the data, anywhere, any place, that people over the age of 65, people in long-term care settings, people with multiple comorbidities, they are by far the most at risk when it comes to COVID, of dying and of being hospitalized. And those were the directions and the guidance that we pursued based on the information that we got from the CDC and from others. The teaching community, the child care community, transit community, there are a number of other communities on the employer side that are right behind those folks. But I think by making a decision to make sure that we vaccinated the people who in overwhelming numbers represented those who ended up in the hospital and passing away first, that was the right thing to do.
Commissioner, is there a people in the room that are eligible right now, they still can't get appointments? I know you said it would take at least a month. Any more thoughts to improving the sign-up process, a centralized booking system, pre-registration, anything after what happened last week?
Well, last week, 70,000 people made appointments. It was a bad user experience, which we own. And we need to do better, and people have been working ever since then to continue to improve both the user experience but also the capacity of the system to manage millions of people on it at one time. But I've said for several weeks now that every dose we get every week, first dose, remember this whole thing is about first doses. Second doses come automatically after somebody gets a first dose. So the whole game about expanding the universe is about first doses. Every first dose we get ends up in somebody's arm. And it ends up in somebody's arm in a big hurry. The problem we have is we get 130,000 first doses a week. And we have a much bigger universe of people who are eligible to be vaccinated. Now, it is our hope, I would say at this point it's more than our hope, it's our anticipated expectation that as the J&J vaccine goes through this process, and as Pfizer and Moderna, both of whom testified in front of Congress today, say they're going to continue to increase their production capability, that we'll have more vaccine. Now, if we have more vaccine, we have plenty of infrastructure to deliver more doses every day. But at this point in time, we're a top 10 daily doser here in Massachusetts. We're a top 10 performer in first doses per capita, and we're number one among the states that are our size or bigger nationally. And I think the big challenge that we face in terms of dosing more people at this point is 100% a function of how much vaccine we get each week from the feds.
Governor, one of the things, Governor, that the teachers talk about, in addition to getting vaccinated, is the ventilation problems in these old buildings. Talks about bringing fans in, opening windows when it's 20 degrees, which doesn't seem like it's going to help much. Are you absolutely sure that those buildings are going to have enough ventilation statewide?
Well, keep in mind that Joseph Allen, who's over at the Chan School and is probably one of the country's leading authorities on ventilation, has basically said that if you want to open the window, you can get 4 turns of the air if you open it just about half an inch, maybe a little more. In addition to that, I don't know what the total amount is, but DESE has spent a lot of money on making available to school districts air purifiers, ventilation equipment, and school districts have spent a lot of the federal money that they've gotten on the same thing. But again, if you look at the data, with 80% of the communities having some degree of in-person education, there's not a lot of evidence of school transmission. And that's not just here in Massachusetts, that's everywhere. And that includes, old school buildings, new school buildings, small school buildings, big school buildings. The mitigation processes and protocols that people have been employing in this have worked.
Commissioner Riley, a question. Is there a sense what wasting doses? The most recent data from the state shows that providers across Massachusetts waste the Moderna vaccine more than the Pfizer vaccine. And as you just mentioned with J&J coming up for review, and with the understanding that capacity is only going to increase, what's the state's plan to make sure that doses don't continue to get wasted on a larger scale with the addition of a third vaccine?
Well, at this point, I think every dose that gets lost is a shame. But remember, some of the doses that get lost has to do with things that have nothing to do with whether or not the shots were used. It could be a bad batch. I mean, that happens. But I don't have today's data, but the last time I looked at this data, the total number of doses that went unused was less than a little over 1/10 of 1%. The vast majority of the doses, the 99% plus of the doses that have been delivered to Massachusetts have either been put in somebody's arm or going to be put in somebody's arm. One of the big benefits of the J&J vaccine, if it gets approved, I feel like I'm waiting for Godot, is that vaccine doesn't require the same degree of deep freeze that we have with Pfizer and Moderna. And so the two benefits to that are, number one, you don't need to have the refrigeration capability in the first place. And the second is you don't have to figure out every night exactly how many you need to thaw over the course of the night to make sure you have them available for your appointments tomorrow. So I think our view is the J&J will definitely enhance performance because it's one shot and it's a lot more flexible with respect to who can use it and how it gets treated, not just at the moment you're actually teeing somebody up to get vaccinated, but how you store it and move it around.
When J&J comes online, as you anticipate, or as everybody's hoping and anticipate, would you be more open to making it more widely available on the local level, fire stations, Board of Health, high schools, wherever, once J&J, because you don't have to freeze it, you don't have all the other things?
I think the strategy that the Commonwealth's pursuing at this point, which is a number of large sites which have been overwhelmingly positive experiences. In fact, I would say most of the best incoming we get in terms of sort of constituent issues is how much people like the fact that all those sites do is vaccinate people. And people are in and out in 30 minutes, and people think the experience is terrific. I also think the continued development of these regional collaboratives, which we now have maybe 11 or 12 of around the Commonwealth, have been tremendously successful. And I would like to see people continue to think about how to do that in the context of their region if something like that doesn't exist, and it would be helpful. I think the thing the locals really need to help us with, and we've said this to them, are the hard-to-reach populations. You know, senior housing, shut-ins, folks who you normally can't, who literally not only can't go to a local place, but may not be able to go to much of any place at all. And then the provider community is going to have a big role to play here as well. Now, they'll be doing it on an outbound basis. They'll be reaching out to their patients and bringing their patients in to get vaccinated. But as more vaccine becomes available, the role and the opportunity for them as trusted advisors to a lot of the folks who are interested in getting vaccinated will be very important.
The in-person learning plan, does that have...
Governor, last week when you announced local boards of health would no longer be distributing vaccines, lots of boards of health are very upset about that. However, it appears that colleges and universities are still going to be able to distribute vaccines within their closed communities. The logic that you used to take, that you explained to us that you were taking the vaccines from the boards of health was so that you could give it to the larger mass vaccination sites which are available to all residents. So how does that logic track allowing colleges and universities to still distribute within their own closed communities?
The only work that I'm aware of colleges and universities doing was around their own healthcare workers who obviously qualify to get vaccinated the same way other healthcare workers do. With respect to the locals, many local boards of health are key players in these regional collaboratives. The local boards of health in Berkshire County, Barnstable County, Franklin County, Worcester County, Upper Merrimack Valley, the Tri-Community program that's just south of Boston, the local boards of health are big players in those. The point here, though, is to have enough capacity so that you can deliver a certain number of shots every single day and are in a position to be able to move people successfully through your process and to be able to do that on a regular basis and to get much better at it because you're constantly doing it. I also can't underestimate, and none of us should, the role that the provider community will play here, especially if we get more vaccine, and the role that our partners in the community health community are going to play.
Does this school plan include
It's so frustrating with the website process. We talk to folks daily that say they get into the system, think they have an appointment, but by the time they enter all their data, they lose it. Secretary Sutters told us last week that they're working to create like a ticker system when you get movie tickets or theater tickets. Any update on that? The CEO of PrepMod told me that is an option that the state can request to have put up there pretty quickly.
People are working on developing a whole series of user interface improvements, and those will be rolled out over the course of the next couple of weeks. And I would say that this is something that's a big focus, along with making sure that the system has the capacity to deal with the potential of several million people being on it at exactly the same time.
Does the commissioner's plan include a minimum 6-foot distancing requirement for students and staff? And if not, what are the resources to help schools that say they can't keep, all their students in 6 feet apart?
The question is distancing question?
Yeah, is there a minimum 6-foot distancing requirement?
So our guidance says 3 to 6 feet. So we've always said from the beginning that we're recommending 3 feet, and if you can do more, you should do so. I would just remind people that in Europe and Asia, and in fact in many states in this country, people are at 3 feet or less. So we're sticking with our guidance, which is 3 feet, and if you can do more, please do so. I think what we've seen even here in Massachusetts is there are districts that are currently operating at 3 feet. There certainly are special education programs that are operating at 3 feet. And anecdotally, we haven't seen any difference between 3 and 6 feet. And we hear that there's going to be studies coming out in the near future demonstrating that there is negligible difference, if any, at all between 3 and 6 feet. So stay tuned for that.
And for school districts who say that they still, they worry they might not even be able to fit all of their students and keep them within 3 to 6 feet, what should they do, or what resources exist for them?
We'll work with individual districts that are challenged by the 3-foot mark.
Commissioner, you had mentioned earlier the idea of taking remote and hybrid learning off the table, but you also said that this all hinges on the health metrics. We've seen them go in a good direction, obviously, but I'm just curious, if they're taken off the table and these metrics go south, how is that supposed to work for the rest of this school year?
So we had districts plan at the very beginning for all three models, for in-person, hybrid, and remote, knowing that they would likely have to shuttle back and forth along the continuum. I think we're in a place now where we're hopeful that now people, at least in elementary school, are going to move towards in-person and that we won't have a setback with variants or what have you. But people are ready to change as needed.
But as far as the exceptions, you had said that there's waivers that would be available. Can you explain a little bit more about how that would work?
Sure. I mean, the easiest example is we have districts right now that are in fully remote, and it may be a hard lift for them to go immediately to full in-person, and they may ask for to start in hybrid first and then gradually move into full in-person.
Commissioner Rowley, does this mean that Boston would not get a pass? Maybe it's a better question for the governor. At times, Mayor Walsh has asked for a delay in moving a phase. Would Boston have to stick to your plan no matter what?
I would assume that Boston has to stick to our plan, yes.
We should tell them about Boston, I thought, was going back.
Yeah, they're actually trying to move earlier. One thing that's important for people to know is there are many districts right now that are in the process of bringing back their elementary school kids, right? They've seen, just by having their schools open for hybrid, that they can manage this, and there is limited transmission, if any. And so people have already on their own begun to migrate towards full in-person. We're just further opening it up for people.
Commissioner, why not work with the teachers' unions? They told us this morning that, you called, Mary and Jimmy told me this morning you called her 15 minutes or so before you made your remarks and didn't even share what the remarks were. Why not work a little more hand in hand?
We have a weekly standing meeting with the teachers' union, and we continue to have that, and we will continue to do so.
Why not? Why didn't you share your plan with them?
We did. We gave them the heads up, the courtesy heads up that we give to legislatures and everyone before we do it.
She said you told her you were making an announcement. That's it.
Well, she wrote back to me and said, we'd like to hear more, and I said, sounds good, and we'll talk about it more. Remember, this has not been approved yet. This is merely me talking to the board saying that we're going to be coming forward with this plan, and then they will have to vote on it.
Follow up on my earlier question about colleges distributing vaccines. I today interviewed students and professors that were eligible under the state's eligibility list, but the colleges are only distributing within their own community. So why should members, and they're getting a point that's easier than people that are trying to sign up and say the Reggie Lewis Center. Why are we making it easier for people at the elite institutions to get appointments?
I don't know the answer to your question. We'll have to get back on. I'm not familiar with that.
Governor, a state senator is calling for an audit of your vaccine distribution and contracting processes. She says she's not getting the answer she wants from your administration about why you're allocating what to where. Also, the oversight committee hearing is coming up this week. Is your administration prepared to give those answers up and defend your course of action?
I think since the beginning of the pandemic, we've had bi-weekly meetings, semi-weekly, whichever one is every other week, with members of the legislature, and we've answered thousands in writing of specific questions that we've been asked about one thing or another. And we're going to continue to be a collaborator with the legislature on issues involving the way we've handled and the way we will continue to handle in the future COVID going forward. And I expect and anticipate that some of the questions that people have raised with us privately we'll probably hear publicly on Thursday, and probably some other ones as well. But, there's weekly conversations about all this stuff that go on between the administration and the legislature about all kinds of things, just like there are weekly conversations that go on between the administration and our cities and towns. We've been doing that. We'll continue to do that. It's part of the nature of the way we believe this is supposed to work. I think in many respects, the lack of supply that's attached to the issue associated with vaccines is a tremendously anxiety-provoking issue. When you get 450,000 requests for new first-dose vaccines each week, and you have 130,000 first-dose vaccines that are available, that creates anxiety. And when you have 1 million people who are eligible to get a vaccine, and you only get 130,000 first doses a week, that creates anxiety. And what we have tried to say to people about some of this is to be patient. Everybody's going to get vaccinated. but everybody can't get vaccinated at once because we don't have enough supply. And this isn't just a Massachusetts issue. This is true in every state in the country. I do believe, not to come back to the J&J piece again, but J&J, if it gets approved, is a single dose. That's a really big deal in the context of how this process works. It doesn't require some of the deep freeze issues with respect to storing and thawing and all the rest that Moderna and Pfizer require. In addition to that, Pfizer and Moderna both said today, Pfizer said they were going to double their monthly production in the month of March. That's a really big deal with respect to dealing with some of the anxiety that people have about their ability to access an appointment, or some of the folks that we have who want to do more to be able to do more. So when I look at this thing from where we sit right now, we'll continue to collaborate with the legislature on all of this stuff. But the single biggest thing that will take down some of the anxiety that people have about pace, speed, and all the rest, because we're putting, every dose we get is going in somebody's arm within 10 days of getting that dose from the feds. The biggest thing we need to take down some of the anxiety is a lot more production and vaccine produced by the companies and distributed through the federal government to the states.
Will any of those website improvements, do you expect any of those website improvements you talked about to be in place in time for Thursday when tens of thousands of new appointments drop?
Well, there's constantly updates that are being made to the website, and we'll certainly make sure that you guys know about them, and we'll make sure the public knows about them as they become available. Thanks, guys.
Are you going to change the vendor?
We're currently working with, we work with a number of vendors at this point in time on a variety of elements that are associated with not just the website, but the whole vaccine program generally. And everybody is on point with respect to the fact that this is a really important week, and we better make sure we get it done and get it done well for people.
Is there a way?
Thank you.